So, buenas tardes. That's probably the limit of my Spanish. So, thank you very much, Dr. Grimaldes and Dr. Elio, for inviting me. So, keratopigmentation assisted with femtosecond laser, pros, cons, obstacles, futures, perspective. I don't have any commercial interest in this. And quick words about the other methods. Drops are not effective, not predictable, so we're not using it. Contact lenses, obviously everybody knows it, but infections still reported, especially with the color lenses. Depigmentation requires several laser sessions, unless I will be told otherwise by Dr. Grimaldes. Impossible to choose the color, doesn't work with the highly pigmented eyes. And as I know, repigmentation may occur after a year. Complications as high pressure might occur as well. Obviously, intraocular implants is something most dangerous and reported with the blindness even, such as glaucoma, cataract, diaphragma, corneal decompensation, and it's very often removed, actually almost 80% after 5 years. So keratopigmentation. We already talked about this. It's proven to be safe in the peer-reviewed journals, mostly by Dr. Elio. It's intracorneal, not intraocular, gives immediate result and painless. Also permit to give you the adjustment later on. I will show you how, and result color changes. I will give you a couple of results before I will show you the method. So it's going to be people who did changes of the eyes. And that's how it's done. First, created the tunnel with the laser. Then we open the vertical cut and prepare yourself for the using of the instrument to open the whole channel. And after that, placing the pigment inside. Our work, we mostly use Biotics Facea, but there are some other companies as well. At this point, I want to show you that it doesn't prevent any examination after that or the surgery. Also, it doesn't change the functionality of the pupil and ciliary body. So from that point of view, it's not dangerous. I still decided to show you the procedure itself. It's a little bit speed up for you just to not to spend much time. But basically, that's what I told you. It's created the tunnel by the femto laser. Then you opening the tunnel with the special instrument which we designed. There are some other instruments as well, but we use the set of instruments which allows not only place the pigment and open the tunnel, but also adjust the size of the tunnel, which, as you know, it's a laser creates a spherical tunnel, and the size of the and the shape of the cornea is elliptical. So we need to adjust this in order to get the limbal ring acceptable for the patient, which is more or less similar on nasal and temporal side. And as you know, because the pupil is not centrically located, it's usually displaced slightly nasally and slightly superiorly. There is some degree of difference on opening of the temporal side versus nasal with the dilation. And then finally you put additional color, and that's what you have at the end. There's obviously some contraindication. As absolute contraindication would be full corneal transplant, radial keratotomy, and full thickness scars if they're not positioned centrally to the tunnel. To the latest time, the keratoconus or keratoglobus was in the same category, but at this point it became relative for many reasons, and if you want, we will talk about that a little bit later. Contraindication relative is just unstable diseases of the eye. It's status post-LASIK for majority of the surgeons for many reasons. Again, I will explain it why. And some other conditions of the lids and the general condition of the eye. So now, results. 100% patients have best corrected vision. 95% maintain uncorrected vision. There is no long-term visual loss. 81% after our questionnaires recovery was easy. 86% didn't report any night vision change, and the dry eye was noticed as a new one in 25% and 31% exacerbation of the pre-existing. Usually in 6 months, it results in 50% of the patients, and basically, adverse effect usually are limited to 24 to 72 hours. It's mostly discomfort, light sensitivity, some blurry vision. In majority of cases, actually, it returns in the morning. And as you would understand, because it's dose dependent, it would be a little bit longer recovery for patients who ask for the high intensity of the pigment. This is the inflammation, really not recorded very much. It usually pre-existing conditions like previous iridocyclitis or any collagenous disease, dry symptoms as well. So frequency of reasons for reoperations. In the first couple of years, because of instability of the pigment, as mentioned by Dr. Alio, the percentage was much higher for the reasons of the pigmentation, or the loss of the pigment, and later on became more psychological, as Dr. Di Natale mentioned. So I'll give you some reasons for changes. It's people wants to just to change the pigment from one to another. It's mostly psychological. That's all three of them like that. And in order to do it, we actually use the instrument which we developed, which allows us to remove up to 80% of the pigment. It's a new generation of this needle, actually gives you even more. At this point, I'm going to give you a couple of words about post-LASIK patients. It's a special requirements. The thickness of the cornea should be not less than 470. The tunnel should be separated from the flap level at least 400 microns, minimal residual bases usually, and that's basically was limitation for many people to use it. At this point, we actually did more than 95 patients successfully. Only first patient we didn't do it because we didn't develop the instrumentation yet. But what you can see, very often you would see some percolation of the pigment under the epithelium, and that's going to be good for any KTP, not just specifically our laser. You also will see some pigment under the flap, majority of cases just close to the vertical cut. It's also need to be paid attention with the patients who is after cataract surgery. As you see, the areas of like entrance to the anterior chamber should be just paid specific attention. Now, in special cases, I want to say about refractive surgery after that. We did numerous PRKs, LASIK, and at this point we did also SMILE surgery. So SMILE after that was first done a year and a half ago. At this point we have already more than 10 cases. I wouldn't say that it's something very much different, except for both of this, for LASIK and for the SMILE, you really need to pay attention very much to the vertical cuts, because the connection between the flap or the cup, in case of the SMILE, is more strong, and you need to pay specific attention to that. But bottom line, it's pretty much the same. You just separate the upper level, the lower level, and remove the lenticle. It's just, in the interest of time, I'm not going to show you the film, the movie until the end, but technically you saw already many SMILE cases the same, pretty much the same way, and the result with the color and with the visual result is pretty much the same. Okay, so patient satisfaction is actually 90+% after the questionnaire. And as a conclusion, KTP assisted specifically with the femtosecond laser demonstrate immediate result, spectrum of color changes, doesn't interfere with the further therapeutic or other tests. About 10% still need the enhancement of the color. In the majority of them, actually, it's psychological. And overall satisfaction, as I said, it's 90%. I just want to show you quick results of like 15 to 20 patients, so you will see the naturality of the result and you judge yourself. And that's basically would be the end of the presentation. But majority of this pictures was taken like 30 minutes or 20 minutes right after the surgery. Some people after, like you see here, after months. But what you see in the next day, pretty much you're going to see for the rest of your life, unless it's a blue color, which is unfortunately at this point not very stable. So if you're interested in more information about this, you can just visit our website or just TikTok or Instagram. Thank you.